anterior abdominal wall extends from the xiphoid process, which lies at the level of 9th thoracic vertebrae, to the pubic symphysis. This is the xiphoid process, जहाँ से anterior abdominal wall start होता है, and this is the pubic symphysis, जहाँ पे anterior abdominal wall end होती है. Umbilicus is the normal scar in the anterior abdominal wall formed by the remnants of the root of the umbilicus cord. Umbilicus cord के root को कट करने की वजह से जो scar रह जाता है, that is umbilicus. Muscles of the anterior abdominal wall. There are 4 large muscles. These are the external oblique, the internal oblique, the transverse abdominis, and the rectus abdominis. 2 small muscles, the cremaster and the pyramidalis, are also present. The anterior abdominal wall is divided into 9 parts by the mid-clavicular line, the transpyloric plane, and the intertubercular plane. First part is known as right hypochondrium. Second part is known as epigastrium. Third part is known as left hypochondrium. Fourth part is known as right flank. Fifth part is known as umbilicus. Sixth part is known as left flank. Seventh part is known as right groin. Eighth part is known as pubis. Ninth part is known as left groin. External oblique muscle. Origin, middle shaft of the lower 8th ribs. The fiber run downwards, forwards and medially. Insertion, most of the fibers of the muscles end in a broad aponeurosis through which they are inserted into the xiphoid process, pubic symphysis, pubic crest, pectineal line of the pubis. The lower fibers of the muscles are inserted directly into the anterior 2/3 of the outer lip of the iliac crest. Nerve supply, lower 6th thoracic nerve. As you can see in this diagram, the origin is from lower 8th ribs. Insertion is an iliac crest, pubic bone, and the abdominal aponeurosis. This muscle runs downwards, forwards, and medially. Internal oblique muscle. Origin, inguinal ligament, iliac crest, and thoracolumbar region. The fibers runs upwards, forwards, and medially, crossing the fibers of the external oblique muscle at a right angle. Insertion, the uppermost fibers are inserted directly into lower 3 or 4th ribs and their cartilages. The greater part of the muscle ends in an aponeurosis through which it is inserted into the 7th, 8th and the 9th costal cartilages, the xiphoid process, pubic crest and the pectineal line of the pubis if does not extend it beyond the costal margin. Nerve supply, lower 6th thoracic nerves and the first lumbar nerve. In this picture you can see the origin of internal oblique muscle is in the anterior iliac crest and inguinal ligament. Insertion of this muscle is in lower 4th ribs and the abdominal aponeurosis. This muscle runs upward, forward and medially. Transverse abdominis muscle. Origin is from the inguinal ligament, the inner lip of the iliac crest, the thoracolumbar fascia, the inner surface of the lower 6th costal cartilages. The fibers runs horizontally forward. Insertion, the fibers end in a broad aponeurosis which is inserted into the xiphoid process, the pubic crest and the pectineal line of the pubis. Nerve supply, lower 6th thoracic nerves and the first lumbar nerve. In this picture, you can see the origin of transverse abdominis muscle is from costal cartilages, thoracolumbar aponeurosis, iliac crest and the inguinal ligament. The insertion of this muscle is in the xiphoid process, the abdominal aponeurosis and the pubic crest. Rectus abdominis muscle. Origin is from the lateral part of the pubic crest, middle part of the pubic crest and the anterior pubic ligament. The fibers runs vertically upwards. Insertion, xiphoid process and the 7th, 6th and the 5th costal cartilages. Nerve supply, lower 6th or 7th thoracic nerves. In this picture, you can see the origin of rectus abdominis muscle is from pubic symphysis and the insertion is in the costal cartilages, 5th, 6th and 7th and the xiphoid process. Action of the muscles of the anterior abdominal wall, support for the abdominal viscera, expulsive X, forceful expiration, movement of the trunk, flexion of the trunk, lateral flexion of the trunk, rotation of the trunk.